Hey guys, happy March. March is National Sleep Awareness Month, so I thought this would be a great opportunity to take just a few minutes and visit with you about the importance of good quality sleep. I can't think of too many other things that top the list of good quality of sleep in terms of its effect on your overall health and well-being and longevity. Diet, nutrition is going to be up there, exercise and movement's up there too, but good quality of sleep is right at the top of the list as well. Poor quality sleep, or another more medical term for that, is sleep disordered breathing, which refers to a wide range of sleep-related conditions. Sleep disordered breathing can affect almost every organ system, either directly or indirectly. And it's something that we need to start paying close attention to and respecting the fact that poor sleep quality will affect your quality of life and your longevity. It affects the brain. It impairs cognitive function. It impairs your memory. Studies have linked obstructive sleep apnea to dementia. So patients who have OSA or sleep disordered breathing are more at risk for developing dementia. Even short-term memory loss. I know that, I'm sure you guys have experienced seasons in your life, nights where you've had poor quality sleep and you're trying to function the next day and your brain just doesn't work as well. Your memory is just not there. So we know it has both short-term and profound long-term effects on our executive functioning, and our memory, and just our overall cognitive ability. So it's really, really important for brain health. It also affects our mood. When you're not sleeping well and when you're not getting restorative sleep with the oxygen that you need, you just don't feel good. You don't feel like eating healthy. You don't feel like exercising and moving your body. You don't feel like socializing. You kind of go into the shell, and all of those things that I just mentioned is really critical to health and well-being. And when you're constantly fatigued, it's really, really hard. So it affects, people who have OSA or sleep disordered breathing are more prone to depression. It has a tremendous effect on our heart and our cardiovascular system. People with sleep disordered breathing or who don't get sufficient oxygen in their bloods are more at risk for stroke, high blood pressure, heart attacks, atrial fibrillation. Your blood pressure goes up because your heart has to work so much harder to get oxygen to the tissues because your blood isn't as oxygenated as it should be. So it has to turn that blood over. Your heart has to beat faster, so your heart rate goes up. And like I mentioned earlier, your blood pressure goes up. And you are more at risk for stroke and heart attack. Those are big deals. So we have to pay attention to this. It also affects your endocrine system, your blood levels, your glucose levels, your insulin sensitivity, all of that gets out of whack when you have sleep disordered breathing or obstructive sleep apnea. So those patients who have sleep disordered breathing are more at risk for type 2 diabetes. It also affects your sexual drive and your sexual function, affects your testosterone levels. When your body's in a constant state of fight or flight, which it is, with sleep disordered breathing, your body's constantly trying to get enough oxygen. Your cortisol levels go up, and increased cortisol levels affect a lot of things negatively. You're more prone to gain weight. It's harder to lose weight, which, makes you more prone to obesity. We know there's a link between obesity and obstructive sleep apnea. But I'm here to tell you, you don't have to be obese or even overweight to have obstructive sleep apnea. I have treated several women who are fit and who are not overweight at all, and they have obstructive sleep apnea as well. If you have any concern about the quality of your sleep or any desire or motivation to improve the quality of sleep, schedule a consult with me and we can visit about your next steps. I take breathing during sleep really important. I take quality of sleep really important, if you can't tell, and I would love to visit with you more about these topics. I'll provide more information in the email below. Check it out, and thanks for listening.